So basically today we're going to start about the pulp. Pulp, which is the most important part of the tooth, due to which we can say the tooth is vital and non-vital on that basis. Okay. Now basically it is the inflammation of the pulpal tissue. Either may be acute, which is also one type of the pulpitis, which is okay. So first of all, when there will be inflammation of the pulpal tissue, it is mean the patient has pulpitis. Either it will be chronic or acute or chronic, with or without the symptoms of reversible or irreversible, which is also one of its time. So you can say this is a pulp tissue. The dental caries or any trauma has occurred. It has been spread to the pulp and the patient has pulpitis. Let's move towards other. You can see here the odontoblast layer. These odontoblast layer which secretes the dentine, and then they are filled with either these odontoblasts either with filled with the minerals or proteins. These are dentinal tubules, as you can see. Tubules have also sensory nerves that travel to the dentine to enamel junction. You can see it's a pulp, periapical foramen is very important, and then saliva. Moving towards the next, this is also pulp. Now they have actually show you the inflamed pulp tissue and infected pulp tissue. It's very important. If a patient has a decay, so the pulp will be infected and there will be abscess. Look at like this. But if it has inflammation, means the patient has inflamed tissue, pulpitis, so there will be inflamed ligaments. These ligaments will show inflammation which will that hold the tissue. So it's very important. If the tissue is infected, so the patient will be have dental caries. So the pulp is infected, so there will be abscess. But it is if either any trauma, so there will be inflammation, the inflamed pulp and the pedial fibers will be inflamed. This is now decay. Okay, then there will be, it will spread to the dentine, then it will also spread to pulp, and then it is abscess, means there is an infection. Okay, then the causes of pulpitis, either with bacteria, traumatic, or antrogenic, means unknown. Caries, which is very common, you can see. Cracks in the crown, any cracks occur, or periodontal pockets are formed. It can also cause pulpitis, or malformed teeth, or malalignment of teeth. Traumatic means any fracture or fracture to the crown, to the root, partial evolution. Partial evolution means it means that the tooth is partially removed by a small, like someone blows you, or there is a fight between two people and one person give a very big shoot to one person, so it will be her tooth is partially removed forcefully. Bruxism. Okay, abrasion occurs, heat generation it can be by during what we can say during filling. uh, okay, the depth of preparation means dehydrated tubules pulp when it is exposed. Toxic disinfectants can damage, and filling materials like amalgam can cause. Okay, now moving towards this clarification is on the clinical diagnosis according to how a pulp is involved, severity, and also according to the presence or absence of direct communication between a dental pulp or oral environment. How the pulp is directly or in either the pulp is in contact or not with the oral environment, external environment. Number one is on the clinical diagnosis, which is reversible and irreversible. If the patient has reversible pulpitis, so the patient will have pulp hyperemia, means there is the blood is. So hyperia means basically hyperemia, that there is an increased blood flow to the pulp. Focal reversible pulpitis and then an irreversible abnormal response to the cold earlier, but when heat it is in late phase. Okay, means it is now in chronic late phase. Okay, according to the involvement, that how much a pulp is involved, either it may be focal, subtotal or partial pulpitis or generalized pulpitis. According to severity, it comes to chronic and acute. According to the presence or absence of communication between a dental pulp and oral environment, either it will be an open pulpitis and closed pulpitis. But in this, I will discuss with you chronic and acute pulpitis according to a severity and according to the clinical diagnosis, which is reversible and irreversible. And the most important, we all know it is that the reversible, irreversible pulpitis. How can you differentiate between reversible and irreversible pulpitis clinically? So, when a pain is a non-leveraging in response to temperature or osmotic changes, non-leveraging means